So today we're going to palpate the bony landmarks of the knee. So we're going to start off with the tibial shaft right here. And goes up into the tibial tuberosity right here. And then we have the fibular shaft that goes into the fibular head. And then we have our patella right here and our Gertes tubercle and pes anserine on the medial side. And then we have the medial and lateral condyles and then the medial and lateral epicondyles. And then our adductor tubercle right here. And then we have our medial and lateral plateau right under the patella. And that's it.
We're going to palpate the ligaments of the knee. So you have your LCL, your MCL, and then the two you can't palpate are your ACL on the anterior side and your PCL on the posterior side. Okay, now I'm going to do the anterior drawer test to test for an ACL injury. And then a posterior drawer test for a PCL injury. So in these two tests, I'm testing for movement in the tibia, or pain, which would show that there's an injury to either of the two ligaments.
Now we're going to be doing a varus stress test, which tests if there's any damage to the LCL. So you're going to brace the ankle and push outward the medial aspect of the knee. And then you also perform this at 30 degrees. Now we're going to be doing the valgus stress test, which tests if there's any damage to the MCL. So just as the other side, brace at the bottom and push inward. And then we also test this one at 30 degrees, and we're looking for any pain that the patient might feel. And while doing these tests, you need to test bilaterally to make sure that they're even on both sides.
Okay, so first we're going to palpate your vastus medialis, and its origin is the distal one half of the intertrochanteric line and the medial portion of the linea aspera, and it inserts at the tibial tubercle, and it extends your knee and stabilizes your patella. Okay, next we're going to do the rectus femoris, and its origin is the anterior inferior iliac spine, and its insertion is the tibial tubercle, and it extends the knee and flexes the hip. Under the rectus femoris, you can't palpate it, but it's the vastus intermedius, and its origin is the anterolateral portion of the upper 2/3 of the femur and the lower 1/2 of the linea aspera, and its insertion is the tibial tubercle, and it extends the knee. Okay, and now we have our vastus lateralis, and its origin is the proximal intertrochanteric line, greater trochanter, gluteal tuberosity, and upper 1/2 of the linea aspera. Its insertion is the tibial tuberosity, and it extends the knee. Okay, now we're going to do the manual muscle test for the quad. So first you're going to put your hand under the knee, and you're going to have them hold this position at 30, and you're going to press against me for 5 seconds. Ready? 1, 2, 3, 4, 5. Okay, so now I have the biceps femoris. Its long head origin is the ischial tuberosity, and the short head origin is the lateral lip of the linea aspera. It inserts at the lateral fibular head and lateral tibial condyle, and it flexes the knee, externally rotates the tibia, extends the hip, and externally rotates the hip. Okay, so now we have our semitendinosus. Its origin is the ischial tuberosity. Its insertion is the pes anserine, and its action is knee flexion, internal tibial rotation, hip extension, and hip internal rotation. Okay, the semimembranosus origin is also the ischial tuberosity. Its insertion is the posterior medial portion of the tibia's medial condyle. Its action is knee flexion, internal tibial rotation, hip extension, and hip internal rotation. So now we're going to do the manual muscle test for semitendinosus and semimembranosus. So you'll brace the back, bring them into flexion and external rotation, and you'll push medially and into extension. Ready? 1, 2, 3, 4, 5. Okay, now we're going to do the manual muscle test for biceps femoris. So you'll bring them into knee flexion and internal rotation, and you'll brace the back, and you'll push them into extension and push laterally. Ready? 1, 2, 3, 4,
And next we're going to be doing a valgus stress test, which tests to see if there's any damage to the MCO. So just the same as the other side. Brace and push inward on the knee. And you also test this one at 30 degrees. Okay, that was my elbow.